All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg University School of Medicine, who answers your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions that we've received through the 7th of September, and we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Vinay Darbakula, an intern this summer with the Institute. And so Vinay, I now turn it over to you.
Awesome. Thank you, Kristen. Today, we'll start with just some basic updates around the country as well as internally with the state of Illinois. So in terms of the United States, the vaccination rate continues to see a gradual increase. It's definitely slow, but today we've reached 51.5% fully vaccinated. It's a 0.3% increase since last Thursday. So that's that gradual increase in vaccination rate. Any increase is a good thing. Then in terms of the positivity rate, we still see an increase in the per day positivity rate for our country at sitting at 161,300 cases per day. But it's a fairly slow increase in the positivity rate. And so while we were seeing a really rapid increase kind of at the onset of the Delta variant, it's still rising, but it's rising a lot slower. Then in terms of the state of Illinois, the vaccination rate is almost identical to that of the country. It's sitting at 51.1%. Same trend as well. It's gradually increasing. And then the per day positivity rate sits at 4,355. This is an increase, but looking at states like Florida, which have 15,500 cases per day, and Texas, which have 19,000 cases per day, Illinois is looking pretty good. One important thing to mention is for the state of Florida, looking at last Thursday, where their positivity rate was about 20,000 cases per day, they've seen about 5,000 cases decline in the last 5 days, which is excellent news for the state of Florida, and hopefully it's a trend that will continue in the future. Then, in terms of some headlines, it was announced yesterday that the U.S. government and the CDC said that Pfizer doses of the booster are going to be available for everyone starting September 20th. Now, we've seen a lot of back and forth in terms of when the booster is going to be available. This seems to be a pretty set date. Dr. Murphy, do you think it is?
Yeah, what's happened is that the information is coming in so rapidly. It's getting updated literally hour by hour. And you've got a lot of different federal agencies involved. You've got the White House, you've got the National Institutes for Health, the NIH, you've got the Centers for Disease Control, you have the Surgeon General, and you have the FDA. So the leaders of that group have been meeting to kind of make sure everything just continues to go forward. And they have looked at the data very closely. And like other countries, like Israel and France and Germany and other countries around the world, they said, hey, you need a booster. And this comes as absolutely no surprise. The hang up has been that the FDA actually is the agency that controls when the EUA is changed, or you're going to add a booster or whatever. Now, the Pfizer vaccine is fully approved, but the booster is fully approved for 2 doses. The booster is not. So there's going to be another emergency use authorization for the booster. And frankly, the sooner the better. So they had thought this was going to be in the beginning of September, and it was going to be 8 months or 6 months, and everybody, or just people older and at risk. It's everybody. And that's because the antibodies, which is just one of the many immunologic markers, are declining. So, okay, so then the committee in the FDA that reviews this, the OVRR, the Office of Vaccine Research and Review, basically said, well, we have a committee and this committee should do it, even though the head of that particular division in the FDA was involved in the overall comments. But, nobody wants to, short circuit the regular approval approach And they have a committee meeting, their review advisory board committee meeting is coming up September 17th. And they expect within 3 days that they'll come up with a formal response. And most likely it's going to be, yeah, do the booster. And that's going to be it. And that's where September 20th comes from, kind of a long-winded answer. But, it's going to be September 20th. It's just a couple of weeks away. Okay, let's just go for that. Now, at the same time, Moderna had submitted their information as well, but they were looking at a half dose of their vaccine for the booster. And the FDA group did not like that and told them to submit the full dose, and they'll look at the half dose later, whatever. So anyway, so they're back at the drawing boards and probably will not have their review looking at their full dose until October. So they're going to be a month behind. Johnson & Johnson is several months behind them.
Got it. And then obviously, as kids go back to school, we've seen several outbreaks, every state around the country. And a lot of younger kids who are under the age of 12, so elementary school kids mainly, are unvaccinated. And so I think a lot of adults were just curious, is there a certain method to keeping kids safe as they go back to school and kind of containing the spread?
Well, I think everyone is a little bit surprised as to the extent of these outbreaks in the school. I mean, there have been many dozens, maybe hundreds around the country. And we're only at the end of the first week of September. Right. It really sort of begs one to think whether going back to school is worth it right now. But we're back in school. So we do the best we can. The kids wear masks, the kids socially distance. That's all you can do. There is going to be a review of the vaccine in kids 5 to 11 years of age. Right now at 12, they can get the vaccine. And so that review, I can't even guess, but it will be sometime this year in 2021. We had thought it was going to be in September, but then I heard October, and whatever. It is coming, and then you'll basically all school children from K through 12 will be eligible for the vaccine, and that's the only thing that's really going to help if the kids take it.
And then just one other thing to add to that, in terms of kind of surrounding the students with people who are vaccinated, it helps. A study from the CDC came out a couple of days ago, making sure that in the 2-week period in mid to late August, ER visits for kids up to the age of 17 were 3.4 times higher in the states with the lowest vaccination rates, and hospitalizations were 3.7 times higher than in states with the highest vaccination rates. And so
I'm glad you bring this up, because it just highlights the importance of getting everybody around those kids vaccinated, because that is the only thing that's going to slow this rate of infection down in kids. And that's really, very supportive data to show that, vaccinating the parents, all the staff and the teachers, everyone at the school, that it's going to help. It will help.
Right. And then one other question, just in terms of the headlines, is just regarding basics in Chicago. What's it looking like? How's COVID doing in Chicago?
Yeah, so Chicago and Illinois are doing, fairly well. And what we've seen is a dramatic decrease in the rate of increase. So instead of increasing 18% or 40% per week or month, whatever we're looking at, it's like 2%. So it looks like we're reaching the peak of the wave in Chicago and many other places, by the way. So, and remember, all these waves do have these patterns. They go up, a lot of people get sick and mitigations get into place, and then it goes down. And I think we're nearing the top of that peak, and Illinois, except for the southern part of the state, is doing pretty well.
Awesome. And then just one other thing to mention is that The Chicago Department of Health is offering $100 Visa gift cards for getting vaccinated against COVID. So that's just yet another incentive to go and get that vaccine if you haven't
Okay,
already
I
done so.
wish I could go get my vaccine again.
Me as well.
$100 gift card. So
All right. Well, in terms of headlines, that's all we have. But in terms of viewer-based questions, we can move on to that part of the segment. So we'll start with the first one. Several people are concerned as with children and COVID and the vaccines in general. And so a lot of people are wondering if there is a major effect, lingering effect on COVID on children's hearts. Some people have reported that their kids, after getting COVID, several months later have fainted. Not sure if there's a correlation. What's the deal there?
well, there is a phenomenon called myocarditis. It's an inflammation of the heart with the vaccines that appears to be real. It also happens because there's other viral infections you can get that can cause the heart to become slightly inflamed. And kids can have chest pain and they can get very sick. Some end up in the hospital, but it's generally very mild and resolves on its own. There's no specific treatment for it other than supportive care, but it's important to make the diagnosis. But this is one of the hesitancies that a lot of people have about the kids. However, look at how many kids now are getting COVID. COVID can do the same thing. It can cause heart inflammation, cause all sorts of problems in kids. So, you always have to balance the benefits and the risks. And the benefit definitely outweighs the risk, because the option is that these kids are probably going to get COVID, and some of them are going to get even sicker than the ones that got ill with the vaccine. So it's just a balance. And, you have to take it into consideration that, the risk of COVID is worse than the risk in the vaccine. And so far, to my knowledge, and, maybe I don't know all the data from around the country, but I have not heard of any deaths in children due to this side effect.
Okay. Awesome. Then just a general question about viral mutation. We've seen a ton of different strains kind of pop up. Obviously, the one in South Africa that's kind of spread to several continents. And so with that in mind, people are wondering, maybe there's hope, right? If the virus is mutating, does that necessarily make it more or less harmful? Is there really a right answer to what's going to happen with the virus mutating?
Well, when you have this much virus replicating in the world, and it's not just the United States, and it's not the North versus the South or the West, it's the entire world, you're going to have mutations, and some of those mutations could make the virus weaker. Some could make it easier to transmit. Some could make it more severe disease, perhaps even more lethal. So anything can happen. And this is why we need to get the immunity increased worldwide to stop the replication. The more replication, the more risk. So if we could get the infection under control worldwide and locally, of course, the better we are, because we'll have fewer mutations and the disease will go away or get down to a manageable level.
Yeah. Then in terms of the mandates that are going on around the state of Illinois as well as the country, some people are concerned with the fact that the mandate is really only for unvaccinated people to get tested weekly. And they were kind of saying, well, shouldn't everyone be getting tested? What is kind of the situation with that, the reasoning as to why it's mainly just unvaccinated people?
Yeah. It's a reasonable question to ask, because vaccinated people obviously get sick. They usually don't get that sick, though. They usually don't end up in the hospital, and they don't die in the ICU. But it's overwhelming evidence that the people that are really getting into trouble and that are spreading this thing, the drivers, are the unvaccinated people. These are the people that are basically making the pandemic worse. It's not the vaccinated ones. their problem is so much smaller. So if for some reason you don't get vaccinated and you are going back to work, the only other thing we can do is just test them frequently. And frankly, it should be more than once a week, I think. It should be at least twice a week, but even once a week, they're going to have to get tested because they're at that much risk. And they put everybody else at risk, vaccinated and unvaccinated.
Got it. And then in terms of, obviously there's been a lot of news about the Pfizer vaccine coming out, getting approved, then the booster is now on dock, but not a lot of news about the Moderna vaccine. So people are wondering, will the booster for Moderna, I guess this was talked about a little bit earlier, but is it going to be the full strength dose? And then is that the same as the third dose that they're talking about? Or if not, what is really the main difference?
You bring up a couple good points here. So the Moderna company was looking at a half a dose, but the FDA would like them to first come with a full dose, just like Pfizer is doing. So they're doing that. It's likely to be submitted in October, will be reviewed. And so it's about a month behind the Pfizer. So that's going to be for the booster for everybody. All right.
Got it.
Now, as far as the half dose is concerned, they'll probably do more studies and maybe they'll submit that as an EUA also. I don't really know what the Moderna plans are. I think will be interesting to see the data that they have, and I look forward to seeing it. It'd be great to give half a dose.
Right.
And then the other issue is the people who are immunocompromised, organ transplant patients with underlying chronic leukemias and lymphomas, and getting anybody on suppressive therapy, that's really not considered technically a booster. It's approved just to give them a third shot, right, because they probably have not made enough antibodies. See, those people are not studied at the beginning. They're eliminated from the trials because everybody knows that they don't respond to vaccines very well.
Right.
So, many groups around the world have shown this, including actually in the United States, that even if they didn't respond to the first two doses, a lot of them respond to a third dose. And, maybe they're going to need a fourth dose. What we really need is a good test to see what the immune response is. And we don't have that yet. That will be most likely forthcoming as well. Everyone would like that same test to see if the vaccine's working. But right now, we have to, those immunocompromised patients just take a third dose. And then they get a booster later. So.
Got it. And then, as always, people are kind of they want some confirmation and clarity about if they're safe doing certain things. And so one question from a family is asking, they have a camping trip planned end of September. There's about 20 of them. They're all vaccinated and it's going to be an outdoor dinner. Is that relatively safe, you think?
I think a group that knows each other, that, knows everybody is vaccinated, should, and they're outside. I think this is fine. I would be very concerned if anybody in that group of 20 had some underlying immunocompromised condition or were at super high risk for complications from COVID. Say an elderly person, over 65 years of age who had some heart disease, or, maybe they had a cancer that's being treated. You would not want that person in the 20 just to protect them.
Right.
They're not going to hurt anybody else. But in general, if everyone's healthy and they're all vaccinated, yeah, they're outside, that should be fine.
Yeah. And then obviously when the virus first started, the recommendations were that students, or just in general, everyone should be maintaining 6 feet apart. That number rings in my head at least, and I'm sure it rings in everyone's head, 6 feet apart, mask, everything. But then some people were wondering now, as school gets back into session, the rules seem to have changed and students are able to sit 3 feet apart in cafeterias and in classrooms. And so people were wondering, is this more of a way to kind of push kids back to school, or is this legitimately tested and safe method of getting kids back into school?
Well, okay. The social distancing is just part of the equation. Remember, there's vaccination, and these kids in school can't get it yet.
Right.
But 12 and up can get it, so they should all be vaccinated. There's wearing masks. There's very good data on masks. Recently, a 360,000 person study in Bangladesh showed that the surgical masks work the best, better than the cloth masks. And they work. They definitely work. And then there's the social distancing. So it's been looked at in a variety of respiratory illnesses, including COVID. And it's been shown that at 3 feet, there is a very dramatic benefit compared to any kind of contact less than 3 feet.
Mhm.
At 6 feet, that increases, but not by very much compared to 3 feet. But and of course at 20 feet, it's going to be even better. And 100 feet is even going to be better. So where do you stop? So the dramatic improvement is most from going from no social distancing to 3 feet. And so that's kind of the minimum. And there's very strong data to support that. So I think that's where we went from 6 feet to 3 feet. 6 feet is, to have school or to have like a busy area as part of the whole mitigation process, vaccines, masks and whatever. 6 feet is tough to maintain in a school. So, and the data are strong for 3 feet. No, obviously they're doing it and, we're having all these school outbreaks, and this is probably because it's Delta. And, whether they go back to 6 feet, there's no guarantee that's going to do anything.
Right.
All right. Maybe they should all be wearing surgical masks. That might actually be better. Or maybe they should go back to remote learning. I hate to bring it up, but, if you really want to be safe with this Delta variant, I don't know, maybe this is, not a time to have everybody back in school. But, they're back in school. So let's live with it and do the best we can.
Yeah. Building off of that, obviously there's a lot of up and down. There's a lot of concerns. Things are constantly changing and research is constantly being done to prove initial theories wrong. And so if someone who is fully vaccinated is very safe in terms of practicing social distancing and it's to a point where they're positive, however, their symptoms are mild, and then their husband is negative, is just wondering kind of what the protocol is. So first question is, the quarantine is still 10 days for someone who's tested positive?
Yes, the quarantine is the same, whether you're vaccinated or not. And it's 10 days. You can get out of quarantine a little earlier, like at day 10, at day 7, if you have a molecular test, or if you have multiple antigen tests, but you would have to have several of those starting at day 5. So typically it's tough to get out of quarantine before 7 days.
Got it. And then she follows it up with 3 questions. I'll just ask you all of them at once because they're relatively quick for you to answer. So the first one is just, are you going to be more immune once you get the COVID? The second one is, could you get it again? And then the third one, I think you've already answered, but just to reiterate, should she be getting a booster shot?
Yeah. So yeah, you can, unfortunately, you can get it again. That's one. Will you become more immune? Will you get more antibodies? Yes, you will. All right. And should you get a booster? Yes. And that will help even more. Because that's what actually is going to happen with this whole thing when it becomes an endemic infection like influenza, where, people are going, a third of the country now supposedly has antibodies, some antibodies to COVID.
Right.
And that's going to continue as long as everyone keeps getting infected. A lot of people are going to get sick. A lot of people, look at the hospitals in Florida and Texas, a lot of people in the ICU, a lot of people, over 630,000 people have died, whatever. It's going to just keep going like that until the immunity for the whole population, and this is then worldwide population,
right,
reaches a point where, you don't have these big waves coming.
Right. Last question of the day is just regarding side effects from the vaccine. And so one person mentions, and I haven't heard this very often, so I think it's relatively rare, where you have periodic pain in your arm from the vaccine that lasts for a long period of time. Like this person has said they've dealt with it for 5 months. And so they're just wondering what the protocol is because no one really knows what to do.
Yeah, it's a very rare side effect. These have been reported from the beginning of the whole vaccine, even since December and January, when people first started getting the vaccines. And there's like an inflammation that is occurring somewhere in the shoulder, somewhere in the area where the vaccine was given. People have just treated the symptoms like an orthopedic doctor or somebody can do something, can diagnose it. They do an MRI scan, and treat it just as like a chronic pain syndrome. But in general, what I've heard is that it does go away. That it's not a long, not super long. It's not a lifetime problem that it should resolve. But if you still have pain this long out, you should see somebody about it and have them evaluate it.
Well, that was the last question. So that's all we have for today. Thank you so much, Dr. Murphy, for all your help.
Great. Thank you, Vinay.